now.
Thank you. So I'd like to call to order the Corporate Administrative Services Committee meeting of Thursday, March 26th for the Sunshine Coast Regional District. And we are on the territory. We are scattered up and down the Sunshine Coast right now. So we're on the territories of both the Shuswap and the Squamish Nation. And we have an update or amended agenda in front of us. Does everybody have a copy of the amended agenda? Thank you. So I'd like a motion to adopt the agenda as amended. Moved and seconded. All in favor? Thank you very much. So we have two delegations with us today. The first one is Dr. Mark Lysician, Deputy Medical Health Officer, and Chris Morse, Environmental Health Officer from Vancouver Coastal Health. Gentlemen, if you want to turn on your video, we can actually see you and have a conversation with you.
Hi there, it's Dr. Mark Lysician. The video is not working for me, so I think you're only going to have the audio, unfortunately.
Okay, thank you. And who's going to start with the presentation?
Yeah, is Chris on the line as well?
Yes.
I am here, yep.
Okay, great. So thanks for having me today. As I was introduced, I'm the Deputy Chief Medical Health Officer for Vancouver Coastal Health. I'm also the Medical Health Officer for the North Shore of Vancouver, and I have been the Medical Health Officer for the Sunshine Coast at various times following Paul Mardiquet's retirement, and as Jeff was doing his training and stuff like that. So I'm happy to be here today, and sorry that Jeff can't be here today. So in terms of this outbreak of COVID-19, this is a newly identified virus from the coronavirus family. It originated in animals. There are various coronaviruses that circulate in humans and cause a variety of types of respiratory illness. Most of them are non-severe respiratory illnesses, like colds that people get in the winter, but some of them do cause more severe illness, like the SARS coronavirus and the MERS-CoV coronavirus. This outbreak began in Wuhan, China in December 2019 and has quickly spread around the world. Currently in British Columbia, we have over 659 cases and over 14 deaths. The median age of cases in British Columbia is 53 years old. There's a predominance of actually female cases in British Columbia, with 54% of cases being female. About 15% of cases in British Columbia have been hospitalized, and about 5% have been treated with intensive care measures in the intensive care unit. And overall in British Columbia, we have had, as I mentioned, about 14 deaths, and that's about 2% of overall cases, consistent with the case fatality rate around the world. The median age of deaths in British Columbia has been 86%. So far, about 30% of the cases of COVID in British Columbia have now recovered from their illness. So within the Vancouver Coastal Health region, the majority of our cases are in the Vancouver area, with about 40% of cases in that area. The next biggest area is the North Shore of Vancouver, where about 25% of cases have been. In the Sunshine Coast area, we have seen very few cases. Less than 1% of all cases in Vancouver Coastal Health have been in the Sunshine Coast and Powell River areas. So COVID-19 is spread through transmission of respiratory droplets, and so that happens when people cough or sneeze or have runny nose and then touch surfaces, and then it's transmitted that way. It's been researched extensively whether this can transmit without symptoms, and the science is still not out on that, although even if it is theoretically possible for it to be transmitted without symptoms, we do not believe that is the most important way that the disease will be spread, because a disease that's spread with respiratory droplets is obviously most efficiently transmitted once people have symptoms like coughing, sneezing, and runny nose, because that's how the virus gets from one person's respiratory system to another. So the symptoms of COVID-19 are fever and cough. These are the most common symptoms, but other people experience things like headache, shortness of breath, and a small proportion of people experience diarrhea. In most people, the symptoms are mild. About 80 to 85% of people have mild disease, and that's consistent globally and also in British Columbia. The people that are most affected are the elderly and people with serious underlying health conditions like heart disease, lung disease, and immunocompromised states. In British Columbia, all of the deaths have been people in their 60s, 70s, and 80s, and predominantly people in their 70s and 80s. Most of the deaths in British Columbia have been associated with outbreaks at long-term care facilities, and we have, I believe, 6 outbreaks at long-term care facilities occurring right now in the Vancouver Coastal Health Region, all in the Lower Mainland. In terms of testing strategies, this has evolved over the course of the outbreak. Currently, the recommendations are to test people with compatible symptoms who are being hospitalized or might be hospitalized, so people with severe illness, people who are healthcare workers, and then people who are associated with long-term care facilities. But in the coming weeks, those testing criteria may be restricted further. I know on the Sunshine Coast, a respiratory disease assessment center has been set up, and they are assessing people with respiratory symptoms, both virtually and in person. They're assessing about 40 people a day, mostly virtually, but also in person, to help people determine if they might have COVID or not, and then thus should self-isolate. They're not testing a lot of people because, of course, many people who have symptoms wouldn't fall into the categories of hospitalized healthcare worker or long-term care facility. And so people who are not tested, if they have compatible symptoms, should assume that they're COVID positive and then isolate for 10 days after symptom onset. So there is currently no treatment for COVID infection, so treatment is supportive, and most infections resolve on their own, and then people become immune to the disease for a certain amount of time. That amount of time has not been determined yet. There are no drugs proven to treat COVID infection, although some research is underway, including in the Vancouver Coastal Health Region. There is no vaccine developed yet, although many vaccines are under development. So in terms of public health measures, there have been measures associated with travel, and just yesterday, in fact, the federal government announced stronger measures with regards to travel. Currently, all international travelers are meant to self-isolate for 14 days following arrival in Canada. And as of yesterday, the federal government will now be doing mandatory isolation of travelers arriving in Canada. So this will not be retrospective to people who have previously returned to Canada because they are under a voluntary self-isolation order. But going forward, it will be a mandatory order enforced by the federal government. Other public health measures that have been implemented have to do with restriction of mass gatherings, closures of schools, closures of food service establishment, or limitation of food service establishment to takeout and pickup only, closure of personal services establishment, and then a request that people maintain social distancing measures in public and also in businesses. The purpose of these public health measures is to decrease the wave of transmission coming into the community so that the healthcare system can manage to treat the people who have severe illness and has enough capacity to do that. The purpose of these measures is not to eliminate transmission. There is transmission occurring, we believe, in every community in Vancouver Coastal Health. It's just meant to slow down that introduction into the community. In terms of what people can do to prevent getting infection, the most important thing people can do is wash their hands, also avoid touching their eyes, nose, and mouth. And then to help protect other people, they should cover their cough and sneeze, and basically stay home if you're sick. That's really the most important message that we're trying to give to people, is that, when you're sick, that is when we think people are most likely to spread the infection, and so that's really when people have to stay home. Although we think that the social distancing measures are important in decreasing the risk that people might be exposed, it's really the people that are sick that need to be isolated most carefully. And so that has been our main activity in public health, is to follow up with all confirmed cases of COVID and ensure that they are being isolated, ensure that their close contacts are being isolated, in addition to the social distancing measures that have been applied across society. And then finally, I'd ask that people, if they need more information about COVID, can get it from reliable sources. If people have questions about symptoms, they should call 911 or 811, or there's an online self-assessment tool where they should contact their healthcare provider. If people are looking for information, they should check the website of Vancouver Coastal Health, the BC CDC, and the Public Health Agency of Canada. So I think now I will turn it over to questions.
Thank you. Did you want questions, or was Chris looking to speak as well? Or is he just here to help answer questions?
He's just here to support, because he will be attending, meetings in the region, where he has been attending them and will be attending going forward. So just so he's aware of the context.
Okay, thank you. So directors, any questions for Dr. Lysyshyn? I'm looking for hands. Anybody? No questions? Director Hiltz.
Yeah, just if you could review the Sunshine Coast and Powell River piece that you said. I didn't quite get what you said, the details there.
Oh, okay. Basically, there have been cases of COVID identified in the Sunshine Coast and Powell River, but these cases represent less than 1% of all of the cases that have been identified in Vancouver Coastal Health.
Thank you. Any other questions, directors? Okay, I have a few questions. One is, we are hearing from members of the community that we have had travelers come back. Now, I know the Quarantine Act took effect at midnight last night, but we have had people who've come back from trips, in international places and are not self-isolating. Then the other is around the social distancing. Certain age groups, but it's not generally just one age group, are not adhering to the social distancing. So what are some of the enforcement methods that can be used, and is enforcement happening? And then who's responsible for doing that enforcement should it be required or requested? Right.
So in terms of voluntary self-isolation orders, there is no enforcement. They are voluntary, and so there is no way to enforce. In terms of some of the social distancing measures that have been applied, the public does have some ability to enforce the ones which involve things that we regulate. So with regards to food service establishment and personal services establishment, so we issue permits to operate to these types of establishments, and so we do have some ability to enforce those types of orders. And so, we have been doing that to the degree that we are able. We are also able to take a more sort of health promotion type approach. So if we are aware of businesses or organizations that might not be following the social distancing kind of rules, we are able to contact them and remind them of the rules, or give them advice if they need it and things like that. And so we have also been doing that. We are not, though, however, going to get involved in situations where people are telling on other people, about information they may think they have about their travel status and stuff like that. That's just not something that we have the capacity to do, or that we think is appropriate. Although, the message is that we want 100% of people to follow these measures, the reality is, in order for them to be effective, we do not need 100% of people to be following these measures. We need most people to be following these measures, and the type of enforcement that is required to get 100% compliance is not something I think that's really indicated. Now, although I'm saying that, as we have this meeting, the province is making an announcement right now about enforcement of social distancing measures, and I believe, well, I'm not hearing it because I'm on this meeting, but I believe there are going to be announcements made from the Minister of Public Safety. So that aspect of enforcement may change as of today. But from our public health point of view, we want people collaborating and kind of working together during this difficult time, as opposed to really telling on people and doing surveillance on their neighbors and things like that. We don't think that's the most important thing that's needed now.
Okay. And then one other issue that's been coming to us is around short-term rentals. We are still getting claims that visitors are coming to the Sunshine Coast, not necessarily people who live here year-round. They have their residence somewhere else, but they're coming to short-term rentals here on the Sunshine Coast, and they're requesting that as municipalities and as governments that we try to do something about that. We don't have the mechanisms to deal with that. It's not in our realm. We don't have the authority to do that. Is that something else that you'd be looking at or not?
Well, travel within Canada is not restricted. There are no restrictions on travel within Canada, so people are allowed to come to the Sunshine Coast, from other parts of Canada. Travel into Canada is obviously being heavily restricted, and so the travelers that are coming now should not be from other places. There's been no restriction on short-term rentals, so as far as I understand, they are able to continue operating. But I encourage you to kind of share those concerns with other levels of government, because the provincial government would have powers that could, take action on short-term rentals. That being said, in public health, we believe that regular or routine cleaning procedures do inactivate the virus, and so short-term rentals are cleaned in between visitors, and those cleaning procedures should be adequate to prevent transmission from one set of guests to the next set of guests.
I think that's one of the concerns, but I think one of the other ones is that typically when we have short-term rentals here, it's a group of people who come. So we have things with people sending us pictures of gatherings. So we have no way of knowing. It might be just a family, but in the one case, they sent me some pictures of, I think, 6 adults and 10 kids or something like that. And they were all together down on the beach. So we have no way of knowing, and we don't know how to deal with that. So I think the community is looking at those kinds of things. How do we deal with that?
Yeah, so the restrictions on gatherings are placed on the organizers of gatherings, and the restriction is around gatherings involving more than 50 people. So that the organizers of gatherings of more than 50 people are the ones that are subject to the public health orders. The other types of advice that is given, where we try to maintain this distance of 2 meters from people, that's advice that's being given to people, and we ask that people follow it. But as I mentioned before, not everybody is going to follow it, and in order to have a good response to this pandemic, we actually do not need everybody to follow it. We have not been advising people against closing outdoor areas, although some municipalities and governments have chosen to close outdoor areas where people are congregating. We think the majority of transmission of this infection occurs in indoor environments, and so by limiting people's access to outdoor environments, you actually encourage them to be in places where transmission will occur more. And so we actually think it is appropriate for people to be outside, in small groups, for small amounts of time. And so we've not been recommending that they close outdoor spaces. But obviously, as gatherings get bigger, we want people to do their best to follow the social distancing measures, but there is really no enforcement of that pending what's going to be announced today.
Thank you. So I don't know who put their hand up first, Director Lee or Director Ties. So one of you go first.
Sure, I'll do that. I think the general population is quite eager to police the rules, but there's lots of misconceptions, I believe there is, For instance, if someone has a cough but no fever, they're not considered to have COVID, I believe. I can't tell from the existing documentation, though, no matter how I look at it. And so the question is, what is sick? And it's not entirely clear, and people are putting their own interpretations on it. And also, there is the close contact conduct for people that are sick. And it's not entirely clear in the documentation what that is. And for instance, just so you understand what I'm talking about, I had a member of the family that had a cough, self-isolated, never did get a fever. And I phoned 811, which took quite a while to get through, but only to find out that if there is no fever, it's best to stay self-isolated for 8 days as a precaution. But the people that have close contact should observe special instructions at the home, but not in public, except for the self-distancing. So my question was, how do we offer helpful hints like that? And how do we get, who would we ask to update the information, both from Canada and the province, if we thought that would be required?
So not all people with COVID have fever. About between 80 and 85% of people with COVID infection have fever. So people with a new onset cough during this time would be, requested to self-isolate. It's not up to people in the community to determine if other people have COVID infection based on symptoms that they might observe. It's up to the person to determine that for themselves in consultation with healthcare providers or the healthcare system. So the places to do that are through 911, through the online self-assessment tool, through their healthcare provider, and those are the ways that people should get advice about whether they need to be isolated, and then it's not up to other people to observe them and decide whether they need to isolate, because they're not, healthcare or public health professionals that are caring for that person. The isolation period is 10 days following symptom onset, as long as all symptoms resolve, with the exception of dry cough, because some people can have a persistent dry cough for weeks after this infection that is not considered infectious. So it's 10 days from symptom onset, that is the isolation period. For contacts of cases, they need to isolate themselves for 14 days, so that is the isolation period, or the incubation period, the period under which the disease might occur in them. And so if they develop symptoms during that 14-day incubation period, then they must isolate themselves for 10 days following the onset of symptoms, because again, that's the isolation period or the communicable period of the disease. So I hope that makes it more clear. But again, the people should seek advice around these things if they're not clear or they can't determine what period of time they should be isolating based on the website.
Thank you. Director Ties?
Thank you. The 50-person limit to public gatherings doesn't really make a whole lot of sense to me. And then there's other countries and other places across the world where they've limited down to 2. So that just leads me to the question: what are the indicators that our measures right now are effective, and looking forward, what are more strict measures that will be implemented if the current ones don't work? And do you have any estimates of timeline as to when we would want all of this resolved? I know these are difficult questions, but I'll pose them nonetheless.
Yeah, so the 50-person limit, the provincial government has, stood up an emergency operations center and system, and it has a planning group that is involved in activities around modeling and using our current cases to see how our outbreak compares to the outbreaks experienced in other countries and the measures they've implemented. And so a risk assessment was performed around what types of gatherings and what would be the likelihood of transmission in those settings. We don't believe that gatherings are the majority, is the main place that transmission occurs of this disease, based on the epidemiology of the outbreak in China and other places. We believe most transmission of this disease occurs in close family clusters, and that is what actually drives the outbreak. And so the 50-person limit, based on the modeling, was chosen to reduce the likelihood that somebody would be exposed in one of these gatherings to less than a 2% chance. So that's how the modeling was done, and so that was where the 50-person limit came. So that there was sort of modeling and scientific work to try to determine what was the most appropriate limit. Now, with these public health measures, you're always balancing the potential effectiveness of the measure with the harm of the measure in terms of people's restriction of people's liberty and their livelihood and things like that. So it's always a difficult decision. I don't know that we will be implementing much more social distancing. I feel like the measures that have been implemented have really changed society. I think it's obvious to anyone who walks around. I mean, I'm walking around the Lower Mainland, but this is not a normal state what we have now. The streets are empty. You're just not running into people. The transit lines are empty. Everything. The situation is really different, and so that's what the measures are hoping to do. And whether it's 50 people or 40 people or these things like that, those differences are not, I would say, significant. Based on the modeling, they are hoping for this flattening of the curve. We will have a good idea to what degree it will have worked by March 30th. So that's believed to be, I think, that's a sort of like the period where we will be able to see what impact this has had on the kind of this outbreak trajectory. Because up until this point, we've been seeing an outbreak that is what I would call average, and not an outbreak that would be described as exceptional, like the ones that they're seeing in Italy, Germany, Spain, and also Hubei, China. So we're seeing something that's much more average, but then at the same time is not as good as the curve that they've seen in Korea, Singapore, and Taiwan, places like that. So, by March 30th, we'll have a sense of the slope of this introduction of cases and the degree to which these measures have worked. And so I assume around that point there'll be a decision point made about whether, because the measures are working, we need to continue them, whether they've worked sufficiently so that we can relax them, or I suppose potentially increase them, although I'm not clear what additional measures they would really do to increase them, and whether those would really get us a lot more impact.
All right, directors, any other questions? All right, I think we've covered the gamut. Thank you, Dr. Lesician, for your attendance at our meeting today. Thank you, Chris Morris. We appreciate you taking the time to be here with us.
Excellent. Thanks for inviting us, and hopefully we can support you well in the weeks and months coming.
Thank you. All right, we have another delegation. This is Paul Kamen. Yes, Sherry?
Hello.
Sorry, Sherry? Yeah,
yes,
go ahead.
Chair, for the record, I'm just confirming that the delegation is the phone number we're seeing on the call.
Paul, is that your phone number that's showing up here?
I would hope so. This is Paul Kamen, Sunshine Coast Tourism.
Yes, does it end in 1963?
Yes, that's correct. That's me.
Okay, that's you. Good. Okay, so welcome, Paul. Paul Kamen is Executive Director for Sunshine Coast Tourism, and he's coming in response to resolutions that we had put to them to take back to his board. So Paul, I'll turn it over to you.
Thank you. Somewhat unprecedented times, everybody. I appreciate you taking the time to speak with me. It has been a very eventful week, particularly for the tourism sector. So to, I guess, summarize, there's two items to be discussed here. One is the online accommodation platform guidelines, and the other one would be the MRDT renewal at 2 or 3%. Obviously, these things are all sort of affected by what's going on with the COVID-19 situation. So perhaps it would be helpful to give you a bit of an update on what's going on with Sunshine Coast Tourism in response to that.
That'd probably be a good place to start. Thanks.
Yeah, okay. We have been sort of reacting to all of this as well. Obviously, travel is, pretty much on lockdown. We are doing a lot of member communications and coordination with all the different tourism bodies, Kaya BC, Destination BC, Destination Canada, the economic development offices like Scredo, as well as the economic development office here in Powell River. We are trying to get the best information to our members, who are all obviously very concerned. We are following the leadership of BBC, particularly around messaging around travel. Basically, explore BC later, explore the Sunshine Coast later. That is our message at this point. I have also been in contact with Julie at the district there regarding a joint communication that I recommended be sent out, because the issue you had just talked about, where people are coming into the community to stay at short-term rentals, is a concern. We've been getting a lot of community feedback as well. So I suggested to Julie to get together with the other communications from other local governments to do a joint statement, similar to what was done with Powell River and the Cathet region, of which Sunshine Coast Tourism participated in. Basically sending the message to the community that protecting the community is our priority, and that all sort of travel should be restricted and people need to be responsible. At the end of the day, there's only so much you can do. You can't physically stop somebody from doing those things, but we can certainly put the messaging out so that our community understands where our priorities are. Obviously, all the DMOs are have great concerns. Our primary funding is the MRDT, which is essentially dropped off a cliff. So we are anticipating a major financial hit to our organization over the next 6 months. So we're obviously I'm in the process of laying off all part-time staff. I put a hiring freeze on the positions that we needed to replace, and we are looking at redeploying some of our staff towards member relations and toward the recovery effort. We're asking DBC to be flexible with that to help us. We're also looking for bridge funding to help DMOs such as ours survive, because we are in, very much the same similar positions to all these businesses, where we're potentially running out of funding really quickly. But at the same time, the work that we need to do is becoming more and more important, particularly around recovery and communications. So we're in a bit of a pickle. We're trying to work through it. So that's kind of what's going on sort of front lines. Like I said, we're working with Scredo and the chambers to put out a coastwide survey for business impacts, which we can move up to the proper channels in government for further consideration, because there's a lot of businesses that are kind of falling through the gaps as far as supports are concerned. Any questions in that regard?
Directors? Director Tides.
Question not necessarily in that regard. More, I think it was more around the decision to not ask for the 3% MRDT rather than to stay with a 2% MRDT, but maybe you were going to cover that later.
Yeah, I will get to that. First, let's, I suppose, deal with the online accommodation platform guidelines. The question that was sent was, what is the rationale for the split of the OAP funds? Essentially, in the guidelines, I tried to explain how, as the eligible entity, it was somewhat of our responsibility to get the ball rolling between the two districts. So I was directed by the board to create a breakdown of how it should be distributed. The board discussed it, and we came up with those guidelines to sort of get the ball rolling. Partially because if we didn't get the ball rolling, the funds would, by the guidelines, would default back to SCT for marketing. So if there wasn't a desire for affordable housing projects, as I was approached by a number of different organizations looking to access the funding. So instead of the funding reverting back to us, I made sure to put a placeholder on the funds with the provincial government so they understood that we were working on it. And I put those guidelines out, and we put the majority of the funds towards housing with a caveat for workforce housing, because that is a serious need of the industry, and it still addresses housing as per our destination development plan. The other items that we wanted to put some of the money toward was toward, priority items in our destination development, which was data analysis and doing an economic impact study of the region, so that I can bring to you real information, not anecdotal information, about what's going on in the tourism sector on the Sunshine Coast. We've commissioned that study. It's going to cost us roughly $30,000. We've started the first phase of it, which is gathering data from the accommodation sector. It is now on hold. The other funding item we were looking to use some of the OAP funds for was to support our events and festivals, who obviously come to all local governments looking for support, as well as to us, as local governments are also turning toward us to help them. And so we were looking at creating a marketing fund specifically for festivals and events to help, again, bring people to our region and enjoy the sort of the cultural assets that we have. The caveat there would be that it would be for marketing, because that is our primary function. So we would be offering marketing supports to those events. Those are the main reasons, and we wanted to have a unified split between North and South Coast to maintain this sort of equity between the two coasts, and a partnership that I believe is paying dividends. And that was the rationale. Any questions on that?
Director Lee, did you want to address that, or are you addressing something else?
I actually had a question about an earlier comment. But if there's no questions on this one, I can ask a question.
Well, go back to the other one, and then I'll come back to what he was just talking about.
Okay. I think we have a responsibility to do clear communications to our residents and our business. And the stay home message is not exactly clear on what is stay home. And from what I just heard from Dr. Mark Lashishin, anyway, he didn't say everybody stay home, including tourists traveling point to point. At least I didn't hear that. So I was wondering, when you decided to put that message out from Tourism BC, Was that on advice from experts, or was that a choice of the businesses?
Well, following the lead of the province is I think, the right way to go, so that we have a cohesive, consistent message across the province. We are in a state of emergency. And I have been taking some pushback from members who feel that we shouldn't be telling people not to come here, and that that we should be promoting right now. I professionally disagree with that wholeheartedly, and I will stand to protect my communities over the tourism industry, because it's the right thing to do. I realize that not everyone likes to hear that, but I'm also in the tourism industry, and I have a private business that is also, in big trouble. So I understand the pressures that are going on, across the board. But if we don't do this and we encourage travel at this point, there's pushback on the other side from all of our residents that are very concerned and have been literally, messaging us. If we said, early on, we were getting messages about how irresponsible it was that we were putting out any tourism messaging. So, we're erring on the side of caution and following the lead of DBC, the provincial government, as well as our local communities, which are saying we need to protect our residents. So that's how we came to that decision. At the end of the day, I don't think we can obviously enforce people from coming here or stop people from coming here, but we certainly don't want to be promoting it at this point.
Thank you. So I'll come back to the other thing you're talking about. You're talking about sorry, I've just started my other call here because we're going to be on a call soon. You're talking about taking some of the money and actually using it to go out to the community and talk to them about coming here and supporting that. And yet the other piece of it is workforce housing. So we don't have enough workforce housing. So I guess what I brought up to you before was actually indicating that if we're going to advertise to have more people come here, but we don't have the staff here to support the businesses we already have, what's the point? So I don't know what the response of your board was to that piece.
Well, again, we're trying to strike a balance here, because while we need support from all the local governments, we also need support from the accommodation sector. And if without their support, without 51% of them signing on, we have nothing. Then there's no MRDT, there is no online platform funds, and then we're back to where we were 10 years ago, or 5 years ago, I should say. So there's a balance here, and that's what we're trying to do, is strike a balance. But if the two boards, the CAFET board and the SCRD, decide that they want all of the workforce or all of the OAP funds, and that's agreed upon, and that's what's sent to us, then the board will have to consider that and respond accordingly. I don't have the answer for that. I'm just here to provide you with the information and direction that they're giving me. Mm-hmm. In regards to the MRDT, 2 or 3%, as per the last discussion we've had, advocating that we go for 3%, as you said, to access more funds so that we can do all of these things, has been heard by the board. At this point, considering the COVID-19 situation, the board is now split on this idea. We have a number of accommodators who are on our board, and they're not in agreement. Some feel that 2% is what we need to do. They don't want to put any more burden on accommodators that are already in big trouble. Whereas the other side of the coin is that we need this money more than ever. It's a consumer tax. Consumers will pay it, and we need this money to rebuild the economy.
So that conversation's still happening, and you'll come back to us when they.
Yeah. So the action that they have directed me to do is to poll or sort of take the temperature of the accommodation sector, to put out a poll or an email asking them for feedback on 2 or 3%, and then from there we can, get a better understanding of, where the accommodation sector is at.
Okay. Thank you, Director Kroll.
Thank you, Paul. I certainly agree with you and the position you're taking on. There needs to be strong messaging with stay at home. People seem to be, and I was a little concerned during the presentation from the medical people. It's sort of like, well, we'll do this and see if it works, and if it doesn't, then we'll increase the sort of criteria and then try again. But every time we do that, it's opening another 14-day window. And so I really appreciate the sort of your personal point of view and the stronger stand you're taking. And, I think it's really important that it be strong communication with, groups of 50. I have a problem with, other countries have taken 2 people and they have to be co-resident. So, I think some really strong messaging needs to come out from all parties involved, and stop this thing in its tracks and stop reopening 2-week windows.
Yeah, I do agree that it's critically important, and from my personal perspective, I have 2 elderly parents in palliative care right now, so it's a priority for me, and the mixed messaging is not helpful.
Okay, Director Lee.
My personal opinion is probably different than the opinion of the experts that we're listening to. But the bottom line of all this is that we have to follow the lead from the people that really do know, not us that are amateur detectives, amateur doctors. So somehow we need to get a consistent message province-wide that clearly defines what we should be doing. It is very tempting to raise the drawbridge and restrict all travel. It's very tempting to say stay home and don't ever go out your door. But that's A, is it necessary? And B, is it the right thing to do? And the only people that can tell us that are the professionals, and we need to follow the lead of the professionals. And if we think the professionals are not giving us good advice, we need to have a way to push back to get that advice changed. The concern is out there in the community, and we need to get clear messaging to the community. And it works both ways here. If we don't allow people to come to the Sunshine Coast, we should not be able to leave the Sunshine Coast. It has to work both ways. So we need that consistent message, and I don't see it coming, and hence my questions. But I just wanted to explain where I was coming from with my questions here.
All right. Any other questions by any of the directors for Paul? No other questions? Thank you, Paul, for being here. Thank you for dealing with our technology. We really appreciate your time.
No problem. And so as far as moving forward, I will correspond back to the board once I have some more information in regards to the 2 or 3% renewal, as well as whether the MRDT process is being deferred. That has also been requested of the province by various DMOs that are in the process. So there might be a deferral coming. So I will inform you as soon as I am aware. And in regard to the OAP am I to expect a response at any point from the board?
Good question. I think for that at this point too, everything's up in the air. You know, we don't know what things are going to look like for 6 months. And so are you saying that money right now is available now or not?
That money's sitting in a bank account. Yes, it's been there for a while.
So so depending on our response to you would determine, your board would take that under advisement and look at how that money would typically be split up then.
Basically, my understanding is that the CAFET board and the SDRB board are going to have a meeting at some point.
Yes, that was postponed recently. It was supposed to actually, I think, be this week, but I think it was postponed because of all of this that's happening.
Right. Well, it was my understanding that when that board meeting happens between the two regions, that you would discuss the OAP guidelines, because ultimately I need a decision from the two regions,
Yes.
and then it goes to the province for final approval.
Okay. So we'll make sure it's on our agenda to bring up at that meeting, which will be rescheduled, and then we'll get back to you. Thank you.
Excellent.
Okay, and I think there's one more. Director Ties, did you have a question?
No, it's okay. For now, I'll hold my comments. Thanks.
Okay, thank you. All right, thank you, Paul.
Thank you. Have a good day, people.
Okay.
Okay. Bye-bye.
Bye-bye. So we have Director Pratt and I and our CAO have a call that we are going to be going on with the province. I think we're on hold. That's the music you're hearing in the background. That's the hold music. I've got it down as low as I can have it. They are supposed to be coming to us at 10:30. I have a feeling it is probably to do with the announcements that they've made this morning to give us a few more details. What I'd like to do is move on until they actually come on the call here, but we're going to skip over items 4 and 5 on our amended agenda and go right to item 6, Annex B, pages 10 through 13. The reason is the two items I've skipped over, 4 and 5, are going to be a longer conversation, and I don't want to start that conversation before we have to recess the meeting to go on this call and then come back. So item number 6, first I'll look for a motion to receive all the reports. Moved and seconded, all in favor? Thank you. So item number 6, Annex B, pages 10 through 13. Did someone want to speak to this piece? Tina, thank you.
Yes. So thank you, Chair. So this particular report here is something staff generate on a quarterly basis to provide an update on what grants are currently underway, projects that are grant funded, grant opportunities. And so this has just been updated for the board for information. So we continue to look for grant opportunities with current projects, and happy to take any questions if there are any, Chair.
Thank you. Any questions by directors? Director Hills.
Thanks, Chair. Yeah, the only question I have is and it seems like almost a stupid question, is there any short-term or long-term downsides to receiving grants?
Tina?
Well, I think some of the considerations when receiving grant revenue and some of the criteria that we use is to seek grant funding or to look for grant funding for projects or that we know are either already in the work plan and or something that is required in the future. So sometimes what can happen with some of the grant opportunities is that it can have a change or impact to your current work plan. So resourcing considerations and capacity need to be considered. Also, if you're wanting to build new infrastructure, you have to understand what the long-term capital requirements or operational needs are to take on any new infrastructure. So, but I would say there's much more upside because, of course, this just means you're receiving funds to fund projects that you already have identified as needed. So it most certainly, from a local taxpayer or funder's perspective, if we can seek other sources of funding, that is very positive.
Director Kroll.
Thank you, Chair. Where these grants say approved, does this mean the money is sort of in our bank account, or it's been approved at a higher level? We haven't received funds. And in light of the way the province is currently doling out money, do you foresee there's any potential that any of these approved funds could potentially be clawed back?
So approved funding means that we have signed an agreement, and there would be probably some significant implications because in a lot of cases, the projects are currently underway. So as of yet, we have not received any indication from the province on changes to this. For the projects that we are still waiting to hear from, I would say those are more at risk than the ones that are already approved. And just, sorry, Chair, one more item to that question is that sometimes grantors, we have to submit a request based on expended funds. So the funds aren't necessarily sitting in a bank account.
Thank you.
If I could just jump in just for a second. In general, just following up on Tina's answer to the first question, the risk to communities when they're using grant funding for projects is when they chase grant funding and move projects forward based on the fact that they got a grant, as opposed to trying to use grant funding to supplement projects that were already considered priority projects on the work plan that were important enough to proceed with or without a grant. The grant funding takes the sting out of that to the taxpayer, or allows you to do more work. The other one, last year, for example, one of the major grant funding programs of the province was canceled, the Rural Dividend Fund, so they could roll some dollars into specific wildfire impacted communities. So part of the answer to the second question is this is an unusual time. It's unlikely, and we've had no word that anything that's already approved will be canceled, but almost anything that has not received a decision one way or the other right now is definitely all bets are off.
Director Pratt.
Thanks. Just to tag on to Director Kroll's question and our CAO's comment, some of these funds, like the Rural Dividend Fund, was one that small rural communities, and we heard this at UBCM, they were really counting on that. So there was a lot of pushback from smaller communities around the Rural Dividend Fund because it's a granting fund program that everybody was counting on, and then to have that essentially be taken away but put towards one area of the province or one industry, depending on how you want to argue it, it created a lot of angst. So it's those types of programs are a bit different, I think, than the other piece. But yeah, I'll mute myself again.
Thank you. Any other questions on this topic? Okay, I'd like to move on to number 7, and then after 7, we will move into a recess. It is 10:28. Director Pratt, CEO McKinley, and I will be leaving the meeting. We're going to go into a recess for approximately half an hour, and then coming back. This is a conference call with all the mayors and chairs in the province to, I believe, fill us in on some of the new steps they've just taken with regards to COVID-19. So item number 7, this is Annex C, pages 14 through 16. We've already received the report, and I believe this is back over to Tina.
Yes, thank you, Chair. So as a result of doing the 2019 financial statements and part of our final audit, we had not done a formal closeout of the Chapman Lake Water Supply Expansion project. That is not included in the financial plan. We also have a loan authorization bylaw for this particular project outstanding. So since this project was anticipated to be a capital project, which did not materialize, we have to change the funding source. So there is a recommendation on page 14. And so I'll take any questions if there are any, Chair.
Director McMahon?
I was just going to volunteer to move the recommendations on page 14 to get it on the floor.
Thank you. Is there a seconder? Seconded? All right. Did you have a follow-up question then, Director McMahon? No question? Director Lee?
Yeah, I have just a theoretical question. I was wondering if it's too early to close this out. If in fact we circle around and we come back to perhaps we need to do something with our dams and as part of the total solution for our water shortage, even if it's simply an emergency backup like we have with the siphon, but make it a permanent solution. Would we start again to fund that if we decided to, or by leaving this open, would it give us an opportunity just to go forward and spend those funds? So that's my question.
And Tina?
Yeah, so the loan authorization bylaw was very prescriptive. It was specified for a project. So if we deviated from that, we would not be able to use those funds for it. So if there was any additional projects up at the Chapman related to was identified with a dam, et cetera, then we would have to, that would probably be a new project, and we would have to identify how we would fund it.
And Director Ties?
Yes, I believe we sent a letter to the Ministry of asking for some of the rationale behind canceling. I don't think we've received a response yet. Is that correct?
Staff?
I don't believe we have. We can look into that.
I think the letter is still sitting in the draft form somewhere with one of the board members. It has never been sent.
Okay. We should look into that. Director Lee?
I got to get faster with this button. That's what I was thinking when I made my comments. And so I had thought that letter had went out. I don't know why we didn't know that letter didn't go out. But is there a downside to leaving this open until we get an answer to that question? Which is what I'm curious about.
Yeah.
So what we could do is the second part of the resolution, which it says to repeal the Chapman Lake water expansion, the bylaw, the loan authorization bylaw 704, that there's no urgency to repeal that particular bylaw. What it does mean, though, is that we continue to have to disclose those in our financial statements as money that we have authorization to borrow for. And it looks a little odd when we don't have that particular project in our financial plan. So what we know from the project is that what was originally envisioned for that project was not approved. So regardless, we would be looking at a new project. So we would probably have to start from ground zero, would be my recommendation. So
and our provincial health officer on the province-wide call.
Thank you. Okay. No further questions? Sorry, Director McMahon?
Yeah, sorry. I just, as far as I'm concerned, this project had a long and tortured history. I would like to drive a stake through its heart and put it away. And then any other projects that we may need to do, because indeed I'm sure the dams need consideration, but let's start fresh. I don't want to beat the dead horse.
Thank you. Director Lee, you had another question?
Yes, I don't think it was a dead horse, and I think there's things we need to do with our existing dam infrastructure, and I believe one of them is to put a permanent emergency backup pipe in place. The dams themselves are going to stay the way they are, I guess. But if we read that letter that we got from the ministry, it said, if you have researched other options, come back and visit it. And that's not something that we are ready to do yet. But I believe once our experts are all finished and looked at the whole thing, I believe there's a strong chance that they will come back with a recommendation such as that. So, yeah, I guess we could start from scratch if we wanted, and if that's their recommendation, but that's a whole lot of work that we don't have to do until we know what the actual long-term plan is. So I think on the side of caution, why spend money undoing something only to have to do it again if it doesn't cost us anything to keep it until we know what the long-term plan is. So that's my thinking on that subject.
Thank you, Director Toth.
Yeah, originally I was in favor of keeping this on the books as well until we knew that we weren't going to use the money. But I think in the name of transparency, it's not really appropriate for us to pivot those funds into another project, even if we can make it work by the definition. We should start that process over if we do decide to do other works.
All right, GM Rosenboom.
Just want to clarify that for any change to the infrastructure up there, any major changes, we would need the same permit that was and the same authorization that was we were denied prior. So for any siphon or anything we would like to do there, we need again to start that entire process with the province.
Thank you. Seeing no other questions, I'm going to call the question on the motion on the floor. All those in favor? Any opposed? Would you like that recorded? Thank you. Director Lee would like that recorded. All right, we're going to call a recess now until, let's do a half an hour. If we can come back earlier, we will. I believe this call will probably go half an hour. So we'll be back at, that would be 10 after 11. Thank you very much. Thank you. All right, so we are back in session. It is 11:20. Sorry for the delay for the public. This was a call with the province giving us more details further to the press release they made this morning. So details will be coming out, and we can share some of that with staff as well. They went into more details on the call than what was actually in the press release. So we have some information that will impact some of the stuff we have going forward. So if we move back into the meeting, we're going to go to item number 4. We're going to go 4 and 5. So this is the Chief Administrative Officer with regards to the financial plan. Over to you, CAO McKinley.
Yeah, thanks for that. And I'll turn it over to Tina to go through it with you.
Okay. Tina? Or do you want me to lead out? Do you want me to lead off first? And I'm up, it's up to you, whatever.
Sure.
Okay. So during the agenda review meeting that we had yesterday, we started actually by saying we passed a budget, a financial plan, basically 2 weeks ago. And in these last 2 weeks, there's been unprecedented change in our community, huge impact to businesses, to residences. And so there was a request to say, what can we do given our budget is actually passed? And all of the projects in that budget, we firmly believe are necessary to move forward. So we brought that to staff, and both the CAO and Tina indicated that they've been working on that. They recognize the situation we're in. And so I'm going to turn it over to Tina to kind of let us know what's happening behind the scenes.
Okay, and just before Tina starts, sorry, the one thing I would say is we have been working on a number of fronts, looking at projects, looking at the financial plan, looking at human resources. I would say we're still very much in the information gathering stage, even though we're making a lot of progress with the information. We're also checking in to see what other jurisdictions are doing, because many other local governments and regional districts are doing these very things at this time. So as we go through this, we don't have a lot of answers yet, but we're working hard to put them together. We envision that it will result in a single or series of emergency board meetings that we can have to make decisions on how to move forward together. And the discussion today is really a great opportunity to gather additional information and get additional direction so that we're bringing something to you for consideration at the emergency board meeting. Thanks for that. Tina, I'll turn it over to you.
Thank you.
Yeah, so thank you, Chair. So if I may, I can perhaps just share my screen. I'm not quite sure how that's going to work, but it'll just summarize some of the budget adoptions and some of the things that staff are considering, if that's okay.
Go ahead, do what you need to do. There you go.
Okay, so can folks see that spreadsheet?
Yes.
Great. So what staff did was we took a look at pulling the tax funded projects for part of the 2020 budget deliberations. And here you can see approximately $807,000 worth of taxation funded project. I've highlighted 2 which I believe are quite critical to the organization, and that is related to the Seashell landfill ground disturbance issue, as well as the future waste disposal options analysis. Subsequent to me drafting this, there's also some critical infrastructure within the recreation facilities, such as the sound baffles, that are in need of replacement. So those are some things that we are looking to see what types of items in here that could potentially be put forward. So senior leadership are reviewing these lists, and these would be some items in subsequent meetings that we could bring forward to propose and provide what the implications to deferring these projects a year or so would be. So the other analysis that we did was as far as the new positions that were approved and how these particular project or particular positions are funded. And a lot of these positions are funded through sources, not just through tax funded sources. We also have some positions such as with the transit, as you recall, was an amendment to the financial plan. So we actually have those staff working right now. So again, we would have to better understand what the changes to the service delivery would be in relation to any staff changing for this and how it would impact it. So approximately $661,000 of those positions are tax funded. So the other thing that staff looked at was areas in our financial plan where we do annual contributions to either operational or capital reserves. And many of these, of course, are tied to our asset renewal plans. So we have a comprehensive list here that we've provided. And this would be some areas that we could look to deferring, but then we would have to better understand what the impact to the service or capital plans would be in the future. So this is another area. The other area that staff are looking at are our current operational reserves. So I don't have the financial sustainability policy up here for us to review, but we can bring that to a subsequent meeting. But one of the policy statements there is that operating reserves can be used to mitigate sudden and marked increases in taxation or unanticipated expenditures for operations. So we could look to some of these operating reserves to potentially mitigate some of the taxation for this year. So this is another area that we're looking at. A couple of other key points that I wanted to bring forward for consideration is, or not just consideration, but just awareness to the board, is that we do not know, we're currently running an emergency operations center for the COVID-19. Right now, there's not a lot of activity per se from a financial perspective. There's lots of activity going on, but no financial implications. But when we look to our other local governments who have gone with extended periods of time for EOC activations, and the local governments need to fund those expenditures prior to getting reimbursed by the province, we may have to consider borrowing funds to expend for the Emergency Operations Center, because the Emergency Operations Center is it's a separate entity that is not associated with delivering the services that we currently have. So that would require a financial plan amendment and potentially some further decisions by our board. And these are some things that the financial officers, especially within the regional districts, that are being discussed right now, is how do we fund this potential EOC on a current and ongoing basis. And then understanding that the things that are within our financial plan, those are not approved to be used for other purposes other than what was approved in our financial plan or within the respective bylaws to deliver those services. So again, just being mindful that we're under a regional district model. The funds that we have in there are specific to delivering those services. So maybe I'll just pause there, Chair, and if there might be any questions.
Okay, we've got Director McMahon and then Director Hiltz.
Yeah, I have plenty of questions, but one of the things that concerns me quite a bit at the moment is that this unprecedented situation is very difficult to handle from a regional district perspective, because because we operate in silos and we can't move money from one silo to another, the fact that we've had to shut down all our recreation facilities, so we may end up with considerable extra funding left in recreation, and we can't move it anywhere else. And at the same time, we're probably going to have some high unanticipated expenditures in other areas. Is there any prospect that the provincial government would look at helping regional districts out with this? Because we're going to have a very, very hard time dealing with it.
Yes.
Yeah. So most certainly this is something that, as part of straddling the EOC side of the house and continuing business operations, that those types of things are being discussed. So if operations are having to change their service delivery model as a result of the COVID incident, we are looking to submit some expense authorization forms to the province for that. Now, we just have to be mindful, because I'm just going to use an example. There's a shortage of masks that one of our fire departments has, but they can transfer those to another entity that doesn't have them. So what we have to do as part of the EOC is make sure that we're tracking those things and recovering those funds for our service. Now, if we need more hand sanitizer at our landfill, and we need to purchase those or acquire them from another source, it might even be from our recreation facilities. We have to make sure we're recovering from the recreation facility and perhaps getting reimbursed by the province to do that as well. So we are tracking all of these particular expenditures within the regional district, but the key point is that we have to seek approval by the province before we expend them. We can't just expend and then expect them to get reimbursed. So they have to be structured. So we're monitoring the impact to the regional district. And I would have to say that it depends what type of expenditure we are looking to incur from a regional district standpoint, from a service delivery standpoint, to see what type of assistance the either federal or provincial government can provide us. One of the areas of concern that we're looking at is we've had to close some of our facilities because of the order and no other reason. So again, those would be areas from business continuity or a business interruption that generally would not be covered by an EOC. Those would be things that I would be looking to see if the province would be helping local governments, whether it just be regional district or municipalities, because I think we're all affected quite the same.
Director McMahon, did you have a follow-up?
I guess I was wondering if there is any possibility that we would be allowed as a special circumstance to transfer money between services, or whether that is just carved in stone.
Tina?
Well, that would mean a significant change in legislation. So haven't heard anything about that discussed. And right now, I'm not sure whether, like, I don't see what requirement that would have. There's different ways we can accomplish the same thing without changing legislation. So
I think what I hear would happen, or what I've seen happen in past years, and we've seen that at the regional district as well, is expenditures happen during the year. We don't know what this year is going to look like, right? I think that's what Director McMahon's saying. We don't know where the expenses are going to show up. It's going to be difficult to tax for those now, not knowing what we're going to have coming towards us. And at the end of the year, we may need to do some adjustments and do some rejigging for next year to reimburse some of these areas. Is that typically how it would work?
well, I think because we're having changes to the service delivery model, whether it's recreation, transit, solid waste, all of those. Yeah, this is a moving target, I would say, hourly. And so I don't know how we would tackle that and think we got it right at this point.
Okay, I'm going to go to the CAO, and then I've got a speakers list.
And really just a tiny follow-up to what Tina said, and related to part of Donna's first question. In other jurisdictions, municipalities as well, but especially regional districts, they're all struggling with these exact questions right now. For what it's worth, even though we don't have a good answer for a lot of these questions, polling the other regional districts, and I had a meeting with about 16 regional district CAOs 2 days ago. If anything, we're ahead of the curve, as poorly prepared as we feel and as many unknowns as there are. And this is going to be one of those things where we don't have the answer yet. We're going to try to figure out the best way forward as quickly as we can.
Thank you. Okay, so speakers list, I have Director Hiltz, then Ties, then Pratt, then Lee, then Kroll, and then Director McMahon back. Okay, so Director Hiltz, you're first.
Thanks. I'm just trying to go back to what Tina was saying about that the EOC is kind of like a temporary service, I think is what you're sort of saying. And so will there be board decisions on is there a discretion that the board will have on the service levels of the EOC, or are these prescribed by the province and the local governments must follow them? I guess just trying to, if there's a discretionary service level aspect to the board with respect to EOC.
Okay, Tina or Dean, who wants to take that one? Jerry wants to take that one, okay?
Yeah, it's a separate process, but the EOC has a management team, and what they do is they go to the policy group, and for the SCRD EOC, the policy group is the board of directors.
Dean?
All I was going to add is that is Jerry's exactly right, and we will be having opportunities to have further discussion on that as well with the policy group.
If I could, Chair, from a financial plan perspective and legislative perspective, the EOC, to Director Hilt's comment, like a temporary service, like I said, if this board is the only one that can make the changes to the financial plan, and so we would have to then make an amendment to the financial plan for the EOC if we needed to fund, or we were looking to fund, say, hundreds of thousands of dollars, because the regional district, we don't have an EOC contingency fund or like a contingency pot of money. And so theoretically, legislatively, we would have to amend the financial plan to operate this particular EOC.
I think the other piece that comes out from that too is EMBC actually has to approve for the EOC to be able to spend money. If they don't approve that the EOC can spend the money, then we know we're not going to get that reimbursed. So that's another piece inside of there. So the EOC doesn't actually just go out and spend money. It has to be something that goes through EMBC to ensure that it fulfills the mandate that's been brought down by the province. Okay, Director Tice.
Thank you, Chair. So at this point in time, we've reduced service levels in recreation, transit, and maybe some other places as well. I'm guessing it's a safe bet to say that we'll be reducing those service levels through at least a couple months. I'm wondering if it's worth doing the math and amending the financial plan to take those into account and reducing taxation by the reduction in service levels. Is it a significant enough number, and is it worth doing that exercise, or is it something that to me, it doesn't make a whole lot of sense to be accruing a whole bunch of reserves throughout this year when people are short on cash, just to give us a break next year.
So those are the types of things that senior leadership is looking at through the various services. The one area that is a little more challenging are the user rate and parcel tax fee functions. So water and wastewater, I would say, because we've already adopted those bylaws, and those are tied a lot to the projects, and we're about to issue utility bills. That would be an area where we would have to really consider how that would be more arduous to proceed with changing that's sort of an essential service to deliver water. But in the recreation and transit, there are several components. So there's fixed cost to operating the transit service, such as fuel, maintenance, etc. But of course, we understand that one of our largest expenditure is staffing to deliver services. So that is a much more complicated answer to tackle.
Hey, did you want to jump in, Remco?
Yeah, maybe just to clarify that as we speak, transit is still running its regular service, and due to additional cleaning requirements from BC Transit, we're actually having more staff working than we usually have.
With less revenue.
Correct.
Yes. All right, Director Pratt.
Thank you. So one thing that I'm realizing as listening on these the provincial calls even just now, I think we, as a regional district, we seem to be a bit ahead of the curve. So if there are any of these things that we're coming up with, like these budgeting pieces, or things that would help us move more nimbly, I think it's very prudent of us to inform the province ASAP in case there is some change in legislation that they could enact just for an emergency measure, whether it's to allow us to be more nimble with budgeting, and maybe move things from silos more quickly if it needs to be done. I know there's some measures that are coming out to help with municipalities and their bylaw ratings, as they stated on the call earlier. But we are in different times, so anything that can assist us with moving things along a little bit more nimbly that would help other regional districts around the province, we can let them know.
All right, Director Lee.
There. Yes, I on that same subject is I understand that perhaps borrowing in lieu of taxation for a short term is probably a strategy we should land on. After all, both the federal and the provincial government is there already. But I understand we can only borrow capital. We can't borrow for operations, but perhaps the government, if we were to discuss it with them, might make some grant opportunities available for certain operations functions for us. So it's, I think the discussion's got to center around the fact that our businesses and our residents, therefore our residents, are cash poor at this time. And if we can help move the funding or the need for funding further down, I think we should be looking at it. So that's my thoughts on this. I was wondering, Tina, is such a thing possible?
Tina?
Yeah, so if I can just address the first comment, which is borrowing. And so in these particular instances, what we would do is we would adopt a revenue anticipation borrowing. And that means that we are borrowing in anticipation of receiving those funds from the province for the EOC. And so that's the method we would do that. And so that's something we already do because we don't get our tax revenues until August the 1st. And so I'm just getting some messages here. So the second part of that is, as far as the expenditures go, and if there's any grant opportunities, I don't have an answer to that yet, because I don't think that I haven't read what the province just released, but that's, I think, what would be interesting to see, how we can get other sources of revenue to mitigate some of these expenditures.
Thank you. Okay, so the speaker list I have is Director Kroll, McMahon, and Ties. So Director Kroll, you're next.
Thank you, Chair. Sort of along the lines of what Director Pratt was saying, and I think is being echoed by most directors, is the big thing that we're faced with is the very likely and huge likelihood of the ability of the taxpayer to pay what is currently in the budget. So, you know, we know the playing field is changing by the minute, but I think, you know, and I think Tina's sort of flagged some things that perhaps could be readjusted or tweaked. But I think we really need to pull the budget down into an area that is capable of being reached by the taxpayers. And, you know, as a regional district and along with other regional districts, just, you know, make joint appeals for emergency measures or legislation that'll help everyone deal with this, you know, this constantly changing playing field. It's not like we're in this boat alone. All the other districts are faced with the same situation. So I think what we really need to do is get our budget in line with what we feasibly think we can manage with, and get it into an area where the taxpayers are able to cope with it.
And I'm just going to say that because of some of the big projects we're looking at, some of those need to move forward. We need to deal with water. We need to deal with our landfill. And so that might require that it doesn't come down where we would like it to come down to. But I think that's the work that staff's going to be doing behind the scenes to bring back to us what is possible. Director McMahon.
Yeah, the province has announced that they are repealing any local states of emergency in favor of a provincial state of emergency. I'm myself unclear about how that affects us. Does that affect our EOC and the funding for it or not?
No. Director Ties, and then Director Toth.
Yeah, my question was a bit of a follow-up on the whole transit thing. So we're still running regular service. I'm wondering if shouldn't we be moving to Sunday service? I thought that had happened, but maybe I was reading about a different jurisdiction. So I'm just second guessing myself at this point.
Remco?
Thank you. There was a discussion. We were considering to do so last week, and we decided at that point in time not to do so, because if we would start running a Sunday service, you would actually get more people on the bus. And given that we're only doing rear door loading at the moment, it would significantly reduce the opportunity for passengers to adhere to social distancing practices. Because the buses would actually get more full than we want them to be. So that's why we're this week monitoring the situation and see what the ridership is doing, and if it's decreasing even further, then we will consider schedule adjustment, and that such schedule adjustment allows us also to align the evening buses again with the changed schedules from the ferries.
Okay, so a request that comes up, or a comment that keeps coming up with VCH when we have the calls with them, is that any impact to transit could potentially impact the healthcare workers and them getting back and forth. So even if our numbers go down, I think we need to ensure that we're in touch with VCH and the various health authorities and care providers, et cetera, to ensure that we're providing the transportation that they need to be able to get back and forth to their jobs. Yeah, Remco?
I agree. That's something that's definitely a big item to consider. The other thing is that we need to have enough drivers available, and that's something we're currently working on and
Right.
getting challenged with.
Okay. Director Toth.
Yeah, one comment and two questions. In the break, I was reading that BC can expect a GDP reduction of 7 to 12% this year. So I think anything that we can do to cut some costs in the short term is going to be a good thing. One question, do we still have ice in our rec facilities? And then the second question is, the list that was screen shared from Tina was items funded from taxation, but not anything funded from fees and charges, correct?
Let's go to Tina first, and then we'll go to Ian.
Yeah, they were tied to specific projects, so not service delivery yet. We haven't gone that far yet.
Right, and Ian?
ICE has now been removed from both of the arenas, and that was following a heads up to our user groups to let them know that we were taking that step in response to the facility being closed. Thank you.
Thank you. Any other questions at this point? I think what we're hearing is staff are going to be working behind the scenes to see what we can do, come back with some options, and we will be relooking at the decisions that we've made. Director Mann.
Yeah, I was just, another thing that came out of the province is that they are redefining essential services. There's different definitions of what an essential service is. And I remember this came up in a previous budget discussion, that what we consider to be essential services is not necessarily what is prescribed under provincial legislation. This is an unclear question, but I'm hoping that maybe you can jump in and provide a little clarity on what is an essential service and who decides.
Dean, do you want to take that one?
It's interesting. It's an interesting question because a lot of times when determining essential services, it's linked to some potential job action or an emergency, and a lot of times it's negotiated. In this particular case, we know we've got to keep the water going. We know we've got to keep the sewer working. We're trying to keep the garbage flowing. We're trying to keep the buses running. But every incident that could come up could change what services may be deemed essential. For example, we could find out from provincial directive that keeping some level of outdoor washrooms open, it would be considered an essential service that would be handled through the EOC and implemented to the extent possible by local jurisdictions. So just like so many other things right now, if the province is looking at a tiered system of services, because as staff, we've been looking at things like, okay, what would almost always be considered an essential service? And then if we're looking at the uniqueness of this response, what are some things that might not have made it into the bucket of purely essential services, but are seen to be critical to delivering on the core elements of our work plan? And what are those things, and what do we need to accomplish them, and how much does that cost? And that's sort of all part of this moving target that we're trying to wrestle with as we look at what changes we may be able to make to the budget, the work plan, and the financial plan. I don't know that that does a thorough job of answering that, but it's.
I've been watching the essential service declarations across the country, and each of the provinces has identified essential services differently. Depends on that province and what is a priority in that province. And then they change them too. So one day it might be considered non-essential, and then it all of a sudden is essential, and vice versa. Director Toth.
It's just, I don't think anybody can answer this for me, but it's just a thing to possibly bring up on the provincial calls. We have, a few days left to ensure that we pass our, that the financial plan bylaw was passed and all that. But Our water and sewer fees bylaws were due previously, and I'm wondering if there's any ability to look at, to talk with the province about allowing municipalities or regional districts to reopen those bylaws and amend them.
We can put that on our list to ask. We have in past asked, and others have asked about changing the dates for the financial plan approval. And they didn't address that today. They addressed some of the other things that have been asked previously. And they've requested that we bring other items to them so they can make sure that they're on their list going forward. So we could put that on the list as well. Did you have another question, or should I lower your hand? You're done? Okay. Any other questions? All right. I know staff have a lot of work to do. Thank you for what you're doing. Thank you for reopening this and looking at what you can do to provide us guidance. I know we and the community really appreciate all the work that you're putting in on this. So let's move to item number 5. This is the budget project status report. Sorry, I've got two mics here, mouse for each computer that I'm working on. Is there anything, given the conversation we just had, is there anything that anybody wants to look at on this in detail at this point? Or do we want to wait until staff go away and do the work they do? Because this budget project list is going to change based on decisions we make going forward. Director Ties.
Thank you. I just wanted to kind of put a bit of a general comment in, and based on the discussion that the CAO had with us, and that timelines on our project list are probably more than 1 year on a lot of things. I'm just wondering if we can be a little bit more specific than saying just not started, but to give us maybe a timeline as to when things might start, when things might end, and so for example, rather than saying just not started, give us a timeline, or when it might start, and then if something has started, maybe then say we estimate it'll take 6 to 8 months to complete this, or 2 years or 4 years. I just found that might give a bit more transparency.
Thank you. Tina?
Yeah, just very quickly, Chair, there is a column there for proposed completion date and actual completion date. So we are looking to, we could always include a proposed start date. And we're also looking to some other formats to deliver work plans. So duly noted.
Thank you. Any other questions, comments on this? Director Lee.
Yes, I was looking through the list, and I believe there's some smaller projects that we could be doing that with staff that could be on the list. It could be moved forward from previous years if we actually find ourselves with the capacity as this thing progresses. But I do recognize that those are lower priority things, but we probably need to consider them going forward. So if we have a project we think could be on the list, even though it's minor and be good to track it, should we be putting that forward to somebody?
Staff?
So I would ask what type of things are we talking about? Things that are not currently on this list?
I'm not sure that they need to be on the list, but things like we could be working on bringing Pender Landing's septic system into our usual flow. It's been hanging around for a long time, and maybe we have the skills now to do it, but not work for that type of person to do it. So maybe now's the time to do it. That's what's on my mind, is those kind of things.
So if I could, Chair?
Mm-hmm.
So if there are projects that are not currently in the financial plan and would require some additional resources, whether it be staff time potentially or over and above, say engineering, then we would have to bring forward a proposal to amend the financial plan if they aren't currently on the list and can't be done within the current funding envelope of that service. So,
Jerry?
Yeah, thank you, Chair. I think the other thing to mention right now, and you've talked about the behind the scenes work that is going on. We are working very diligently to gather and really clarify all of the staff status reports right now. Those that are working, those that we need to work to continue with our essential services, the things we're operating right now, assessing for potential redeployment in the EOC. And we haven't talked about business recovery, but I mean, at some point that will be a future state thing. And definitely the projects that are moving forward at this time and a reprioritization, I think, is going to be a big part of all of this. So, and while we're doing that, of course, we have staff who are off work, either required to self-isolate or are not available. So I think it will become clear as time goes on here, but at this point in time, that's the work that's going on behind the scenes. Thank you.
Sorry, Dean, you went on mute now. Did you want to speak, Dean?
The only thing I was going to add further to what Jerry had said was that that's another, the idea, and further what Tina said, if there's some projects or items that staff that we aren't able to keep busy some other way, we could keep them busy on other work that we could resurrect onto the work plan. The idea might be that if those things don't have those additional costs associated with them, the cost is having a person that we would, under regular business conditions, have working anyway, working on a different item that moves us forward. That's an area that a lot of jurisdictions are looking to explore. But as soon as those, bringing those other items forward, if it has additional cost components, that's where it gets more complicated. But we, like other jurisdictions, are looking to see where those opportunities might exist based on some of the research we're doing on who's doing what and who's available and et cetera.
Thank you. Any other questions or comments about the spreadsheet? Nothing at this point. So let's move on to communications, numbers 8 through 10. First, a motion to receive all the communications. Moved, seconded, all in favor? Thank you. All right, so let me get to Annex D. Any comments on any of the communications? So Annex D. Director McMahon?
Yeah, I know this is not foremost in our minds right now, but I note in the report from the Ombudsman that the #1 subject of local government complaints is bylaw enforcement. And, locally, I feel that our enforcement policies are out of step with public expectations around bylaw enforcement. And that somewhere down the line, and it sure won't be this year, we do need to have a public consultation about how we do bylaw enforcement.
Thank you. Any other questions on Director Lee?
I was just wondering on the thank you, Chair, by start. On the UBCM proposal to consolidate resolutions into a single resolution, I do believe it's a good idea. But somehow the people that put the resolutions in need to have a chance to vet that resolution to make sure it's clearly reflects the intent of their resolution. And what comes to mind is the one about consultation. it got a little bit different than what we put in, and surprise, surprise, we see it at the convention. So, just comments. Do you think we will get a chance to make sure that consolidated resolutions do reflect our concerns?
So at the bottom of that letter, it indicates that if you have questions about resolution streaming or the resolutions process review, you can contact them and ask those questions.
So that would indicate that when they consolidate it, they will circulate it prior to the convention, so we get a chance to comment. Is that
No, no, that's not how I read it. I read that they're proposing that this is what they do, and if you have questions about what they're proposing, to contact them to get clarity. So inside of your question, if they're looking to combine resolutions, is inside their process a step to come back to the original proposers of the resolution, whatever it is, to ensure that the one that they've put together meets the need and deals with the issues that was put forward by that organization.
Yes, that's exactly what I was.
Right. So I don't know do we want to handle that as a board, or would we like Director Lee to contact them and get his question answered? Sherry.
Thank you, Chair. The current process, and they do that somewhat already, is to inform us, not consult.
Right, and they're changing the process.
Correct. So if we require clarification, perhaps a resolution can be made that we contact them to get clarification on that particular issue about consolidating resolutions, whether or not local governments will be consulted in advance.
Thank you. Director McMahon?
Yeah, I was just wondering if we needed to have a motion here to do that. If so, I'm happy to make it.
Okay. Director Pratt?
I'll second it.
Okay, so Director McMahon, what would you like to say?
Oh. I move that we contact UBCM for clarification on the process for was it combining motions? Amalgamating motions?
Consolidating.
Consolidating, thank you.
Okay, and so and you're looking for how they come back to the original proposer, something like that. How does that come back to us to ensure that the consolidation actually then meets the initial intent of the resolution?
Absolutely, that's what I said.
Tara, do you have something? Do you want to read it, or are we okay with Tara just crafting something there for us? Tara's going to read something.
Thank you, Chair. I have, and that staff contact the Union of British Columbia Municipalities to have clarification on the process of consolidating resolutions, and also how the proposer receives their response from the consolidated resolution.
I don't think that quite fits what we're looking at. I think what we're saying is, if we have 4 people putting in resolutions that they consolidate together, how do we ensure that the resolution that they've made up of these 4 actually meets the intent of each of the people who put that resolution forward? Because they each come with a little nuance. Is that then reflected in the resolution at the end? Yeah, go ahead, Donna.
Yeah, well, the question is, are they going to send the consolidated motions back to the original municipalities to ensure that they are approved, or before it goes to the convention?
Right. Okay, Sherry?
Thank you, Chair. So my understanding is that we would contact UBCM for clarification on the process and to ensure that local governments are consulted in advance so that the consolidation meets the initial intent of the resolution that was proposed.
Perfect. Yes, Director Pratt, are you okay with that too? All right. Any other questions or comments on this? All those in favor? Thank you. Anything else in the correspondence? Okay, seeing nothing else, we have a motion to go in camera, that the public be excluded from attendance of the meeting in accordance with sections 91K, M, and 2B of the Community Charter. Would someone like to make that recommendation? Moved and seconded, all in favor? Thank you. And then I have to go over to staff. Are there any questions that have come forward from our gallery? Have we had anybody in our gallery, first of all, and then are there any questions?
This is staff. We have 2 people in the gallery at the moment. If I could ask your patience while I solicit for questions.
Thank you.
I've had no questions from the gallery at this point, and I've offered if there are any follow-ups to put them in chat, and I'll pass them outside of the meeting.
Thank you very much. All right, so we need to give staff time to close out the other meeting and bring in the rest of our participants. And then we all have to go close doors and do those kinds of things too, right? To make sure that nobody else is around. I will be back in just one moment. Other mouse. Thank you. So we have just come out of our in-camera section of the Corporate Administrative Services Committee meeting of March 26th. And I'd like a motion to adjourn this regular meeting. Moved and seconded. All in favor? Thank you. We are adjourned.
Thank you.
Great.
Thank you.
Thank you. See you.
Thank you.